Well, I had a wait list of, I think it was 16 or 17 families by last year that said, "Can you find me someone who can do this?" And, when I said, "Oh gosh, I don't know what clinicians around me can do this," a light bulb went off and said, "We've got to capacity build here. We've got to figure this out."
If you've thought about starting a ketogenic diet or ketogenic therapy for mental illness, but have a hard time finding a clinician, or if you're a clinician wondering how you could get involved and learn how to do this, well, hopefully we have something for you. Today, I'm joined by Deanna Kelly, who's a doctor of pharmacy at University of Maryland, and she's starting an innovative study about training and teaching clinicians how to start a ketogenic diet on themselves and doing it as a study to measure their competence and sort of what they need, how they're doing, to then be able to apply that to their patients. So it's totally innovative. It's called Live It, Launch It, and Deanna's going to tell us all about it. Now, you may also know Deanna Kelly. She is the professor in psychiatry for mental illness research at University of Maryland, and we've interviewed her before about an inpatient treatment program for patients with schizophrenia that unfortunately got shut down by the Maryland Department of Health. And so we have episodes about that. So she gives us an update on how that's going in her always, positive and optimistic manner, which she has. And then we also talk about her other area of expertise, which is the metabolic consequences, the metabolic side effects of psychiatric medications and the use of GLP-1s, how that plays in versus ketogenic therapy. So we really talk about a number of different things in this short interview with Deanna Kelly, but mostly about this innovative, really cool research study that hopefully will help sort of expand the ability to apply ketogenic therapy to so many other clinicians. So I hope you enjoy this interview with Deanna Kelly. Hello, Deanna. Welcome back. Thanks for joining me again at Metabolic Mind.
Hi, good morning. Thanks for having me.
Yeah, it's so good to see you again. And I mean, you're always busy with so many different activities. So I know you've got a CME activity that you're going to record soon. That'll be fantastic about the metabolic consequences of psychiatric care. You've obviously got your study that you've been working on with some
Yeah.
hurdles that we've talked about. So maybe we'll get an update on that. But the main reason for this interview today is your Live It, Launch It new activity. So I want to hear all about that. So tell us what Live It, Launch It is and why it's important for us to know about it.
Yeah, well, thanks so much for asking. So this is really exciting for us. This is really what I think of as a capacity building project. And really it came about because of the clinical trial that we were running with the ketogenic diet, which we'll come back to. But during that time, during the initial months of getting that study started, we had tremendous outpouring from the community around us, people asking like, how do I get a clinician? How do I find someone to help me know what to do? Or even the clinicians involved are thinking like, I don't really know enough. I don't feel confident with what I'm doing. I don't even know where to begin. And it just over the past year, it's really hit me. We don't have a good way to sort of help, besides sending people off to do it to get trainings or here and there, but people in their busy lives just don't have time to do this. So we decided to do this project called Live It, Launch It. So in Maryland, we are piloting a project with 40 people where we're actually going to have them learn what a ketogenic diet is and how to do that and how to help for mental health, but then also have the chance to live it. And so that's the unique part of it is that we're hoping that, and I'll talk more about the educational initiatives I've done before, like the competence of actually learning how to do it and feeling competent can change behavior and help people feel more comfortable because knowledge itself doesn't necessarily help people dive in. And that's really with the launch it part. Like we're hoping if people live it, understand it, they can launch it.
Yeah, so cool. So clinicians are going to actually get themselves into ketosis, follow a ketogenic diet, live the ketogenic lifestyle, see what it does for them, experience firsthand maybe some of the struggles, maybe some of the difficulties and some of the benefits, and then learn how to implement it into their practice, right? So I think
Yeah.
that's so cool.
Yeah, and it's couched in a research study. So we are studying this whole process. So we are actually going to study things like self-reported competence, like how confident are you in all these different domains? And like I said, in the educational space, when we teach people, and give them knowledge, there's lots of data that says like you can teach them everything you want, but that doesn't change behavior. So the step in between is sort of can you feel knowledgeable, but then can you feel competent? If you lived it and you feel like you can help someone, do it, then you can implement it more. And so, yeah, we're going to be measuring things like self-reported competence in different domains. But then for the live it piece, people have the opportunity to get labs. They'll have labs done. They'll have self-reported mental health and physical health measures as well. So they can see in a period of time how that actually might translate into like how they feel so that they can then in turn, share their experiences with the people that they might treat or educate themselves.
Yeah, I think that's such a great idea. I mean, I've interviewed so many people, so many clinicians, and the majority of them, or I can't say the majority of them, but a high percentage of them has said like, I tried keto for something and then I realized how amazing it was. And then I realized I could do it with my patients. And it was a lot of that personal journey really helped people sort of embrace it and probably feel more competent in helping their patients take it. So I think it's such an amazing step. Now, how many clinicians do you hope to enroll for this?
Yeah, so we had set it at 40 and we had 40 people sign up. So we have about 60 some people who contacted us. We obviously, since it's a clinical trial, we have inclusion and exclusion criteria. So if people did not meet criteria for the ketogenic diet, if they've done it before, if they're pregnant, other reasons why. But we had an outpouring of support. We had a wait list, and then we went through the process of informed consent. So we have, I believe, as of yesterday, we have 40 consents. So that's the 40 people will participate. I believe most people will be doing the entire two phases, the educational plus the live it, the launch it, the lived experience part. But I think a few people, based on some of the inclusion criteria, can't do it all. But for all intents and purposes, we have 40 people ready to go. So I'm excited that we're on track and we had such an outpouring of support.
That's amazing. Are they all mental health professionals? Or are they across the gamut, or what's the makeup?
Yeah, no, it's across the gamut. So we're located in Maryland at the Maryland Psychiatric Research Center. And so, the idea sort of grew out through my own communities. Like, there's people in my own backyard who don't do this and I don't know how to get everybody connected. But, we have some people locally, but we have people from all over the United States. So many states are represented. We will be able to send lab slips to them. We'll send the Keto Mojo to them. Everyone's going to get a packet that's going to be mailed to them. And it's going to come with, here's everything you need to get started, et cetera. But we do have, in terms of clinicians, I don't have the final breakdown. I'll hopefully have that in another week or two where I can look at it. But I believe we have the gamut of psychiatrists, psychologists, social workers, nurses, physician assistants, pharmacists, other mental health specialists. So that's going to be the fun part is that the multidisciplinary piece of this, we're going to learn from this too, right? As researchers, we're going to understand the different disciplines, what they like, what they don't like. And I think then as the broader community helps people adapt, we'll have data to help, sort of see what do they like, what do they don't like, how do people see this different? Because everybody's going to approach this, or everyone's going to come with different experiences, and they're going to teach it a little different. So it's going to be fun to learn from each discipline on what's helpful, what's most important for them to take forward.
Yeah, and I love that they're all keto naive too. Like they haven't
Hmm.
done it before, so it's going to be a
Right.
new intro for all of them, which is it was super cool. But what's the structure of the education? Is it like an app? Is it online coaching? Is it how? Tell us a little bit more about that structure.
Yeah, no, actually, we've partnered with Denise Potter, who's a registered dietitian. She has worked with the Charlie Foundation and obviously some experts from there. They've put together a keto mastery class for psychiatry, and that's how we'll start. We're going to really start with a developed class. I know there's other people in this space doing fantastic trainings. We selected this because it's asynchronous. People can go online. They can look at there's about 4 hours. There's group question and answers that people will be able to come back to. But then we're going to work with the dietitian group, the broader group from Denise Potter's program, and we'll have everybody go through some dietary consults. So everyone will understand, like, how do I log my food? How do I select, my food? How can I learn a couple of techniques? Should I use a keto calculator or should I not use that? How can I, like, what are my strategies? Everyone's going to use the chronometer or the chronometer, however you say it, and people are going to log their foods, be able to pick their macros, and sort of see how that works for them as well. And so we're going to start that. That's really part of the educational process. We'll be doing before and after assessments of how much did you learn and how competent are you during that process, and that's the basis for getting started. Once we get started, we will be doing weekly group meetings with the dietitians and with the group so that we can talk to each other, talk about what's working, what's not. And, I'm going to be part of this group as it happens too. I'm going to be along every step of the way. So excited about
Oh,
it.
so cool. Yeah, yeah, that you can take part in it. That's great. And
Mhm.
how long is the intervention or how long is the study period?
So we have we're it's about a 4-week period people have to complete their asynchronous like learning and go through that process. And then we're doing a 4-week dietary intervention. So while we know that that's not an ideal time for everybody, but it gives people, these are busy clinicians, right? These are people who are giving up their time to fill out assessments, to jump in, to meet, like people's days, we're all busy. And so I'm really grateful that people can squeeze this in. We're trying to make it as easy and user friendly as people as can do, but we're gonna be about 4 weeks that people be doing the dietary intervention together.
Yeah. I love this. I mean, I'm so passionate about educating clinicians, and that's why we're doing, various CME projects like I mentioned that you're involved in. But I mean that only goes so far in educating them. It's that real life experience that it just takes it to the next level, which is, I mean, challenging to do on a large scale, but here you are showing with 40 people, here is a model that we can do it. So I'm really curious to see the outcomes of this, and to see how their confidence and their feelings of competence change during that, even though it's a short time period. Can
Right.
they change enough in that short time period to then feel more confident recommending it to their patients? I think it's such an amazing model that if it works, could be implemented. I mean, could you see, like, expanding this to even more and more clinicians?
Oh, I would love to. I would love to take what we learn from this and actually, like I'm hoping that people give us feedback too. Like we're having data collection tools where people can weekly sort of give us information on like, oh, this might work for a patient. I really need to think about how to deal with this with my patients. Like what are those steps we need to know as we could roll this out to be an easy way for people to learn and the best way for people to learn and implement that. So we're going to learn ourselves so that the next steps could be just that. And so that the broader community could learn from this, not just me. Like I want everybody around me to learn how to do it because I, have witnessed the sort of the power of it and understand the efficacy. But I want everyone else to be able to benefit from the data we get in house so that their educational programs and the way that everyone else, like this spreads, nationally or even globally on helping with anything we can on the educational front.
Yeah, and I mean, I guess I probably should have started with this, but tell us about your experience and what led you to, in wanting to know more and implement ketogenic therapy for treating mental illness. Like, how did that work for you?
Yeah, so I mean, I think a while back when I first started the keto diet, I think I talked to you a little bit, but I had originally, I've been in the mental health, schizophrenia in particular, research for 28 years. So looking for new treatments and looking for holistic treatments because medications are just not the answer. I've looked at metabolic side effects for a lot of my career. Was first to publish on the area of, antipsychotic weight gain and diabetes in our young patients with like risperidone, even some of our, first and second generation antipsychotics. And so it's been really passion of mine to sort of improve care in this space. And while looking for dietary interventions and while going down the road of looking at subgroups of people who respond differently and helping people find personalized treatment, I actually had a family friend who had a daughter with intractable seizure disorder who was treated with a ketogenic diet, and the understanding that mechanism was really an interesting road for me because like how does this work, like I'm just hearing about this is maybe like 6 or 7 years ago. I'm hearing about this for the first time, and then I started to sort of understand how this works for mental health as well as some neurologic issues. And we were really excited to get started last year with a ketogenic diet, and as you know and as a lot of your listeners know, um, we were halted in the state of Maryland because of new changes in policies to the way things are funded. But nothing because of the study itself. And we're actively trying to work with the state administration to possibly change that and put some put changes in place so we can get started again. So, but that's how that came to be. I'm a fighter, so I'm not giving up because the science will win, right? The science and if changing how people feel will win out, and I just want to make sure we can get that message out there. And this is part of the capacity to help everyone around us to learn what to do to get started.
You're so positive and and so
Mhm.
energetic about this. I love it. So if people want to hear more, we have, I think, 2 or 3 other interviews that you can go back to learn about the study as it was ongoing and then as it got stopped, but yet the drug trials were allowed to continue, but the dietary intervention
Mhm.
trial was not allowed to continue. And then the big sort of outreach. And I mean, talk about the community coming together to really try and educate the powers that be that decided to not allow the study to continue. And I mean, you can see some movement. I guess you're not up and running as of now, but do you think there's been a favorable impact that this might end up resuming soon?
Yeah, so I mean, I just want to thank everyone out there who had played a role in this. Like I was blown away when if you look on change.org that Dr. Chris Palmer started independent of, of my work, 21,000, almost 22,000 people signed up, saying that they support and almost 1,200 people commented about how this has impacted their lives. Just that in and of itself was powerful, right? That data right there says this matters to people. And I one door closed, another one's opening here, but I am actively working with the state. There's new change in the health department, some of the changes in the health department. I do think that what matters in the state of Maryland is trying to make sure people have good care, people have access to care, and this is an idea of access to care. Of new treatments that could help people do well, could help people get out of the hospital, etc. So those conversations are actively happening. I have faith in this process. I can't guarantee we're going to have this overturned or not, but that's where I can lead you down right now is that we're actively in the middle of those negotiations. So hopefully, but I wanted to tell you, I just wanted to let you know, we were able to look at some of the very early data because it got stopped, as we were just getting started. But we are getting ready to publish a case report from our first person who went through the study, and so that's been submitted for publication. But I just wanted to note that in our person that the first person to go through the study entirely was someone who had many antipsychotics on board, including two, like clozapine and olanzapine, both with metabolic side effects. And we're gonna, talk more about that. But difficult medications that cause a lot of side effects. And our person, in a very short period of time, had a 69% decrease in their HOMA IR. So they went from, type 2 diabetes to in the normal range in that short period of time with antipsychotic treatments on board like clozapine and olanzapine. So that's just a little snippet of what we had seen. I was excited that we had that result. This just lends itself to show the support that, this could be a powerful intervention. That's just the, on the metabolic side, that's not even the hint that symptoms are improving as well. So
Yeah, I
yeah.
mean, that's remarkable, and it
Mhm.
really is timely, though, because, there was a recent study, a randomized controlled trial about using a GLP-1, semaglutide, for people who are on antipsychotic medications, to see how it impacts the metabolic consequences of those medications, and, there was significant weight loss,
Mhm.
normalization of blood sugar in over 80%, so it was pretty dramatic, so it could be another use for these a little bit difficult to get, expensive medications that have some side effects, but in certain people in the right population have pretty profound results. So how do you balance that? The bright, shiny new medication with the dietary intervention that could show the same thing, but isn't getting the same support to study? Like how do you balance those?
Yeah, well, I mean, we are dealing with medications that have a lot of, research and development and money behind them. So like there's a lot of marketing that happens, and I've seen this in other areas of my career, like with other medications that have been generic and they've been hard to get out and get to people who need them. And I've seen this access to care issue all through my career and have actually worked a lot of my career to try to like get access to care. So Of course, like there's a lot of excitement because there's money in this and there's, you know, but I'll see it as this is that medications can be very good. I'm a pharmacist. That's my training. And this is what I've studied with my career, but they're not the end all be all. And this is how I got into the field. Like, if they were, I wouldn't be talking about diet with you because it wasn't my expertise. You'd be talking to the dietitians, not to a pharmacist. But because I have been doing research and I've been seeing what's been powerful and what's been working, I know that not every single person is going to do really well in an antipsychotic or even the other treatments that you start to pile on so these people that are on these GLP-1 agonists, that's great. Like we might have some people, this is going to be what's really important for them. And it starts to jumpstart and get people, but not every single person is going to do well on that. There's side effects. There's pancreatitis. I've already seen pancreatitis in cases locally. There's other things to watch out for. And as we add every antipsychotic or other psychotropic or other medication to the next, we bring about potentially other side effects too. So it's a breakthrough. And it's really great that we have that. But we have to understand that the understanding the core of what's going on is possibly more powerful than just treating and we're also with the GLP-1 agonists, we're losing, a part of the efficacy of it is the loss of weight. I find it interesting is even in my experience so far in some of my patients, even without weight loss, we can see the metabolic improvements on the keto diet. So that's a different sort of mechanism. It's a different way we're getting to the underpinnings of metabolic dysfunction in and of itself. And so we need to get the word out there about keto, but we have to recognize that there are people that aren't going to be able to do that, and GLP-1s will have their place for sure. But we see this with all new medications that come to market, and at the end of the day, we need to make sure we can continue to fight for an access to care for other things that don't have the same backing and funding as the um, shiny new meds do.
Right,
Yeah.
right, right. And like you sort of alluded to, there's also the potential to treat not just the metabolic side effects, but the underlying psychiatric condition as well, as we've seen from Shabani Sethi's publication, Albert Danon's publication, that they can the people with schizophrenia and as well as bipolar disorder and major depression, but they can reduce their medications and improve their symptoms after starting a ketogenic diet. Now, obviously, we need broader, bigger, randomized controlled trials, which are ongoing right now,
Yeah.
to
And
learn more
there's
about it. But
Right, and there's hints too. Like we think of psychosis as just someone with schizophrenia as having just hallucinations, delusions, etc. But there's a whole host of other symptoms that go along with that, like the idea of negative symptoms of lacking your desire and motivation to get things done, and communicating and going to school and having a job and interacting with others. Like that's a big those are big factors that impact your functional capacity and how what you're doing in life. And those things matter. When you talk to families and the moms of people with schizophrenia, for example, they'll say, I really want my son to come out of his room and to get a job and to interact. I want him back. I want that back. So these negative symptoms have not been treated previously. And so a GLP-1 agonist is not going to treat negative symptoms. In fact, they might actually make them worse potentially. But potentially, like we need to look into that. But, there's a hint from some of Judy Ford's data from California, and there's a hint from even our case report that, we might, and Shabani and others, they've obviously shown some global symptom changes, but even the negative symptom side, these other domains that we don't think about and that there's no FDA treatments for, this could be a space where we can make a difference with a ketogenic diet because it's getting to this underlying, pathophysiology that could also improve negative symptoms potentially. So that's my hope and we saw that hint in the case we're publishing as well. So yeah.
yeah, such an important point because, like you said, we do talk more about the psychosis symptoms
Mhm.
and a lot less about the negative symptoms, but
Mhm.
equally as important to treat, if not more so. And I was saying, there are ongoing randomized controlled trials, but what's so interesting is it's a dietary intervention. It doesn't have to be, a pill that's FDA approved. So people could start it under clinical guidance, and that's why training the clinicians is so important so that they could get comfortable doing it, do it safely as an add-on to standard of care. Like you don't need randomized controlled trials necessarily to do that for a diet to really impact someone's life.
Right. We don't have to wait for FDA approval here. I mean, certainly, we want evidence-based, but their evidence is accumulating. There's a lot of data out there. People can get started and try this without having to, wait for a drug to come to market. And so, yeah, people need to know how to do it. And, I had a wait list of, I think it was 16 or 17 families about a year by last year that said, can you find me someone who can do this? And, when I said, oh gosh, I don't know what clinicians around me can do this, a light bulb went off and said, we've got to capacity build here. We've got to figure this out. So, yeah.
Yeah, so that takes us full circle back to
Mhm.
your study that you're doing to train those 40 clinicians to learn how to do it, to live it, learn it, or sorry, live it,
Mhm.
launch it,
Mhm.
which I think is amazing. So you have to promise me you're going to come back and tell us the results when you accumulate the data and have it ready to publish.
Absolutely. We'll be excited. And there's so many people excited about this. I have a new postdoctoral fellow coming from American University. She's a nutritional neuroscience PhD, which is a new PhD out there. And Brett, I sure hope that this field continues to grow because, people like her and training the field in different and novel, innovative ways. When we combine nutrition and neuroscience together as a degree, like that's so we're just growing the educational realm. We're growing the future clinicians in this space and the future researchers too. So yeah,
Well,
excited.
I really appreciate your passion and your tireless work in this area. So thank you so much, and thank you for joining me to tell the world about this. So I look forward to seeing you again.
Yeah, thanks again for having me today.
Fellow mental health clinicians and healthcare providers, you now have access to a suite of free CME lectures on metabolic psychiatry and metabolic health. Each of these CME sessions provide insight on incorporating metabolic therapies for mental illnesses into your practice. These CME sessions are approved for AMA Category 1 credits, CNE nursing credit hours, and continuing education credit for psychologists. And they're completely free of charge on mycme.com.